feel free to. And, wow, all right.
I don't know why I made that.
And if you need any more food, there is plenty. So please feel free to get up and go get more food so we don't have to figure out what to do with it afterwards. I appreciate you coming and rating the teacher fair and the student club activity outside to find us over here. We almost always typically hold this meeting on the other side. So when you're a creature of habit, you sort of wander in the same direction. So there may be a couple people that wander in after we start, which is fine too. So just very casual. Welcome to the Lunch to Learn. Texas State University for many years had an organization called CERG, which was the Center for Children and Families. And CERG had an event like this where people could come to eat lunch, but mostly to meet each other. When I came back to Texas State in 2012, it was a lifesaver for me because I immediately met people who were interested in the things that I was interested in research and grants. And I found mentors and I found people that I probably would have never found otherwise because I probably wouldn't have left my building had I not been able to squeeze in a lunch learn, get lunch, learn something. It was very, very impactful for me. And so this year, Translational Health Research Center decided to try to reinvigorate the idea of the lunch to learn. We're fortunate because Abby Mott, who is Assistant Director of THRC, was actually the planner for those original events for many, many years through the Center for Children and Families. And so we just decided to try to breathe some new life into something that people miss and people ask about a lot. And when it went away, it was really unfortunate because it was really one of the few places on campus where you could have informal question and answer discussions to learn more about how people do research and sponsor programs at Texas State. So here we are. This is our second Lunch and Learn, and I appreciate you coming very much. Our format is set up such that we seek to have a theme across two talks. And truth in advertising, I have a proxy for one of those talks because the person who I would have hoped could do it was not available because she's at a conference. So I am involved in the project, but I just want to make that very clear that Elizabeth Eager is the PI on this project. And she works along with Jessica Snyder and with a whole team of people that I'm going to be talking about. But I've been around on the project since the beginning, so I'm very familiar with it, and I feel like I can represent it. After I talk for about 15 minutes, our second speaker is Josh Daspit from McCoy College of Business. We're very fortunate to have Josh because he's very, very involved in a program called SCALEUP, which you might have heard of. He's going to talk about it, so I won't go into it. But we heard about it, and as a center, thought, how can we add to what is happening with SCALEUP by working with Josh Daspit? And he's going to tell you the results, and it's pretty exciting. So to get started, I'd like to, thank you. I'd like to talk about a project called COPEWELL. And there's two sort of objectives for me. One of the objectives, of course, is to talk about our COPEWELL project specifically. It is an evidence-based program that we're doing in conjunction with communities in Texas. The second part of my goal, and I think a goal of Josh's as well, is to show you how Translational Health Research Center does our process of building projects that have a lot of tentacles going in a lot of directions. I get questions often about how we do what we do, or more specifically, what do you do? And I want to make that as clear as possible, but providing two examples. And so I'm very pleased to be able to present COPEWELL and very pleased to have Josh to present the GRIT Awards, which he's going to talk about. So this project is called COPEWELL. This is not a name that we made up. This is an existing program that was created by the Johns Hopkins Center for Health Security. So when our center started, I realized that I needed to quickly ramp up resilience research. We have a mission and we have funding to build health and economic resilience research for Texas, to create healthy and resilient people and places. And I realized that if I started from zero, it would be very difficult to create a research project that would have traction to be able to tell a story within such a short period of time from October 1st till the end of the school year. So I looked around and I realized that we had a faculty member here at Texas State named Monica Shock-Spana. Monica not only has a faculty appointment in the Department of Anthropology, but she also is a senior fellow at the Center for Health Securities at Hopkins. And even better, she studied resilience. So I sought out to build a relationship with Monica to work on this project, COPEWELL, and that's how the situation started. So before I talk specifically about COPEWELL, I just wanted to tell you a little bit about where I'm going. I'm going to talk about THRC and share our mission and goals. Very much framed this project because it was one of our very first projects. Talking about how we seek partnership opportunities. Our center does not have faculty researchers. We support faculty researchers in other units. And so building those relationships for us is critical. A very important part of that is providing opportunity to faculty because we do the legwork to establish networks, establish connections, establish entry points for our Texas State faculty to do their research in places or collect data in places that they might not otherwise have the bandwidth to try to develop themselves. And so that partnership opportunity piece is critical. So I'll talk about the project components and then the next steps. So the first thing that I mentioned was that this was the beginning of THRC, Translation. As a center, we were an initiative for many years. We did proof of concept. We got the seal of approval. And along the way, I was asked to write grants to support Translational Health Research Center. I wrote 3 grants during the pandemic, and 2 of those grants were funded, one of which was a proposal that brought us a strategic initiative focused on health and economic resilience research. So we have a charge not only under translational health to help build the profile of Texas State research and support Texas State researchers, but also to foster healthy people and places in Texas through resilience research. So to do that, I sort of looked at it with these components. I still want to develop Texas State faculty research opportunities. That's embedded in everything. To do that, I need help. I need a variety of statewide research infrastructures that can help me to provide opportunity to faculty, because I never know what kind of research is going to come in our door. I never know what kind of grant proposals are going to be available to us. And when they come, that is not the time to start thinking about, oh gosh, where could we do this and who could we do this with? You have to start before that. So building the ground game is what I call it. I think about, if you are familiar at all with Texas A&M's ag extensions, they have these cooperative ag extensions in every single county in Texas, 254. So if you think about the ability to go to communities where whatever you study is particularly relevant, or the ability to collect data, or the ability to have trusted community members partner with you to build your credibility as a researcher. We don't want to be the university that just pops in, collects data, and we're out. We want to have impact. We want to bring back our research findings to communities to do something that matters to them and matters to us based on the evidence that our research creates. And so therefore, that statewide infrastructure was key. I realized very quickly that, sorry, my line of don't pass is right there. I realized really quickly that, there's a lot happening in the cities, but the cities of Texas have a lot of resources. What does not have a lot of resources are our rural communities. And I thought it was really important to make sure and be very intentional about building a statewide network or networks that would help us bring people in rural areas of Texas into the various programs that our faculty could create. Obviously, we're a research center. We're not doing this because we think it's cool or we think it's interesting. We're not making it up as we go along, although it might feel like it sometimes. We are working off of evidence-based practices that come from research. So good science. It starts with good science. It starts with good social science. It starts with best practices that are tested, that have evidence that they actually work. Because that is what I think we as a university can bring to these communities. we bring something different because we're not just, thinking and brainstorming what we think would be cool or think would be useful. We're bringing evidence-based practices. And so to do that, we have to have evidence. We have to have the community where it's relevant, and we have to make those two things come together. And then finally, I like the novel. What's new? If it exists already, we can still potentially bring it to a community, but it's even better for us to build our Texas State Research Mission by doing things that are novel and new and needed, and then making sure that they're shared and implemented with the people that can benefit from them. So making sure that our research is not ending in an academic publication in a journal. I know that's part of the deal, but that does not extend any of the evidence that we create as a community with our community in Texas or in the world. Our impact comes from what we do with what we study, and what we study is what we find. And if we don't do that, in my opinion, we're missing a huge opportunity to have a real impact in this world. So that's kind of where we started and how we started on COPEWELL. So COPEWELL starts with the question: if you could predict community resilience, what would that look like? So resilience is often defined as the ability to predict, adapt, or recover from adversity. And that adversity can be something like a personal challenge when you think about kids in school and resilience related to grit, or it can be a natural disaster like a hurricane or a tornado, or it can be the loss of a business, like economic resilience. So resilience comes in many forms, and there's a lot of research at a lot of research centers that study resilience. However, most of them study it within a particular discipline or a particular paradigm that limits what they do to infrastructure or water or climate or whatever it is. And we're looking at all of the different facets of resilience, health and economic, that shape the lives of, in our case, because of our funding mechanism, people in Texas. And so that is where we wanted to start. So COPEWELL was created by Johns Hopkins, as I said, faculty researchers there. They had a grant from CDC, and they built this evidence-based tool. And it's very useful because what it does is it brings together community members who have discussions about things, to decide on their values, to decide on their needs, and to assess ways to address the biggest gaps that lead to a lack of resilience when bad things happen in their community. And it had a variety of different tools associated with it, et cetera. But for us, we saw it as a way to convene communities, to talk about the things that matter to them around resilience, to build workforce to help make sure that they have the people. If you need to have X kind of skill, do you have that kind of job in your community? And if not, is that something that you might want to think about working to get? So thinking ahead and putting resilience top of mind as these communities go about their day-to-day business, when this is not something that they think about until something like the pandemic happens, and then they're forced to. So COPEWELL is not the work of Translational Health Research Center. I want to be very clear about that. But I will say that Hopkins had almost no plan or very little plan to actually share it once it was created. The goal of the research project and the grant was to create COPEWELL. Pretty much hard stop. And that really solidified the point that I felt we had something to offer them, and I think they agreed. And so we had a great partnership that was born from that. So this is the research project that we developed with COPEWELL and with Johns Hopkins. Monica Shaxpana was involved in this for sure. In the fall of 2022, we decided to host a town hall meeting. And that town hall meeting was a national town hall. And when you're working with Hopkins, you can get a really good audience. But what we did was we identified Texas speakers. Specifically, we had, for example, a hospital administrator from Pampa, Texas, that brought such a rich perspective to that discussion. When you get the wonks, the policy people, the inside the beltway people, and then you have the research administrator from Tampa, Texas, that tells them how it really is, her voice spoke volumes. And so having the ability to be part of that conversation was so helpful. And then from that, we really promoted it to organizations in Texas, because our part 2 goal, besides raising the visibility of Texas State as a partner in this, along with Johns Hopkins, which is about, right up there, as good as you can get when it comes to the study of resilience. We also wanted to identify community partners that we could work with who might have attended the town hall meeting to find out about COPEWELL, because we thought, if they hear about it, they might want to do it. And if they want to do it, that creates an opportunity for us to work with them on research. And so the result was really, really unexpected. It was not a hospital system. It was not a medical insurance company. It was not a, I don't even know what else, other kinds of pharmaceutical company. We thought it was going to be hospital health based. Not. Again, unlikely partners, building a research infrastructure across the states. The best thing ever happened to us. Josh very kindly suggested that a woman named Maria Freed from the Texas State Library and Archive Commission, that's called THRC. It's right on the Capitol. It's on the square in the building adjacent to the Capitol. And they are sort of investing more and more into the mission around health literacy, and kind of around, quite frankly, finding a mission for libraries in rural Texas towns where many of them are being closed. So we have a resource, a library, that can provide information about health literacy, economic literacy, workforce development, jobs, all of these things. And they're under, some real scrutiny, and many of them are being closed. They're being closed in the 77 counties of Texas that have no hospital either. So we have no hospital, no library, no access to information about health, which, in my view, set the stage to say, hold on, we need to have a convening to bring people together from this community to figure out, how do we do resilience? What are we doing? Because we need a plan, right? So that's kind of what we did. We identified THRC as our partner, and we're moving forward. Flash forward to spring. Jessica Snyder leads our faculty fellows program. Josh is a faculty fellow. They work together to do this project in selecting. I apologize. Josh introduced us to Maria. I just looked at the projects. Jessica worked with Elizabeth Eager, who was our identified person to bring this forward. And Josh was very supportive. He was there all the way. In spring 2023, Elizabeth was identified as a faculty fellow and funded to lead this project. We went through a very rigorous process to take applications from communities that wanted to be part of this. And shockingly, we got a lot of applications from communities. So we set criteria, came up with 2 communities that we thought really had the best chance of making this a success. The goal of this project is to understand how communities build resilience through community coalitions, how they organize, how they structure, how they resource resilience-related values that they decide upon themselves. And even better, Elizabeth is teaching qualitative methods, so she was able to bring in her graduate students to take part in this whole process. So they're getting this on-the-ground experience. We selected 2 communities, one's in North Texas, one's in far East Texas, and they're working with these communities to collect the data. So we have student learning opportunities, research that is evidence-based, partnerships, Texas State faculty research in rural areas. It hits all of those things that we're seeking to do. As I said, this is a team. Besides Elizabeth, Rex Long, what we could offer Hawkins, Monica, was we funded the doctoral student that was the liaison, because I couldn't expect either side to really carry the load in our partnership, especially at first. But Rex was singularly tasked with making sure that we were connected, that we knew what each other was doing, that everything was cohesive, and he did an amazing job. And then Jessica came as the fellows representative, working to not only identify Elizabeth as a fellow that would take us forward, but originally kind of working with Monica as an ad hoc fellow, if you will. Her plate is a little too full for a full fellowship, but as an ad hoc fellow, helping make sure that she was connected into the program too. So the outcome of this that I just have to share, and then I'm all done, is we're now able to build a statewide library network. And the thing that's coming next that I want to share, well, two things. One is we have a report coming out about this project any minute. And then the second thing is that we are right now selecting library sites to build telehealth suites in Texas libraries where we can collect all kinds of data, where we can connect into communities where there are health disparities to help people. And they will be Texas state entities sponsored by Texas State telehealth suites in libraries. And that's happening this summer to build out this network for future projects. So we have a couple of projects right now, 2 or 3, that will be embedded in these clinics. And it's just really exciting. So we're trying to build that network of collaboration for future faculty fellows, future projects, future Texas State grants. And we really, really hope that you will help us to make the most of that and take advantage of that by working with us in your research program. Thank you. Black line.
Black line. Where's the black line?
Black card is the.
Like, what is it? Like an invisible black line here? Good afternoon, everyone. I'm Josh Daspit, and it's a pleasure to be invited to speak with you all and share some information about SCALEUP and the great opportunities that have come from working with Melinda and team THRC, Chair, etc. I'll say Melinda is correct when she said that she had, I guess, heard about SCALEUP very early on. It was part of the Big Ideas Part 2 that the university had a few years ago. And one afternoon, I got a call from a number I didn't usually. I don't pick it up. Happened to pick it up. Is this Josh? Yes. Hi, this is Melinda Villagran. I'm a faculty member at Texas State, and I heard that you were doing something called SCALEUP. Yes. Then let's chat. Do you have a few minutes? And that's how it started. So not exactly certain how you found out about it, but your research skills are quite impressive.
No, your reputation preceded you.
For better or worse, I don't know what reputation I will. But as you mentioned, I am the director of the SCALEUP program, and the focus of SCALEUP is on two main things. One is to better understand why minority businesses are not growing, scaling at the same rate as non-minority businesses. And in addition to that research side, the second component is to then create some evidence-based tools, as Melinda mentioned. Evidence-based tools that are scientifically proven to help those businesses grow. Now, there are a lot of resources currently available, and many with good intentions. But are they actually helping minority businesses grow? And the short answer is they may be effective, but we're seeing quite a substantial opportunity gap. In fact, if the gap between minority businesses and non-minority businesses was closed, to say it a different way, if minority businesses grew at the same rate as non-minority businesses, that would add over $6 trillion to the US economy. Trillion with a T. And it would also create over 20 million new jobs. Now that's including all minority groups looking at a national level, but we all know the demographic changes happening in our own state. The thought is, if we can make even a small change to either or both of these numbers, that's a substantial impact. And it does not stop with publishing the paper, having that article accepted in print. It ends with actually bringing those tools and resources to minority businesses. So as I mentioned, the SCALEUP program was proposed to the university as a university level program after the part of the big ideas part 2. And we are officially a program of the CID. So that's our parent organization, if you will. That happened in 2019 and 2020. And they said, well, congratulations, you're now awarded, you're now recognized as this big idea part 2. Full stop. Now, I said, well, where's the check? And so I was a little surprised at that point, to be quite honest. I'm sure this video will get back to someone in administration. So I did not say any of this, but yeah, I said, well, that's fantastic, but how on earth are we going to scale the SCALEUP program? How are we going to develop this program? Dan Roy, who is the co-director of CIE, helped tremendously with this effort and many others. Long story short, we received some seed funding from Frost Bank, Frost, now known as Frost, by the way, Frost Bank. We received some seed funding that allowed us to hire 3 research fellows. So we were able to hire them last year and do conduct some initial investigations with small businesses throughout the state. And let me back up here. We have those research fellows. Early on, we were connected with TMOC. We were introduced to TMOC, which is the Texas Association of Mexican-American Chambers of Commerce, located near Austin. And they're kind of the chamber of chambers. TMOC quite well. They represent over 700,000 Hispanic-owned businesses in the state. So that was an excellent connection. And speaking of connections and relationships and those things, we were able then to form or create an official partnership for an MOA with the organization. They've been very helpful with putting us in contact with small business owners throughout all parts of the state. Additionally, we happened to meet Maria Freed, who Melinda mentioned. Maria came to light during a webinar session. We were invited to participate in the governor's webinar series on small businesses, and in the chat came a question, happened to be from Maria. We didn't know who Maria was at the time, and the question was, have you all considered distributing the tools that you develop or will develop through libraries in the state? And I had to be honest. Nope, we have not. And so that essentially started that partnership, and she's been fantastic. And their organization's been fantastic to work with. As Melinda said, they oversee or work with all public libraries across the state. And so after some of these partnerships developed, that was about the time I got the famous call from Melinda asking to learn more about SCALEUP, and the fellowship opportunity developed. Since that time, we have accomplished quite a bit. One of them I'll share with you today, a few more details about the GRIT Awards. And we recently received a grant from the Kauffman Foundation, which will support our programming for the next 3 years. So we're very excited about that. So in terms of research support and support in general, well, you mentioned this, but I honestly don't think you did it justice. To say that another way, I don't think that you gave THRC enough credit for what you all have done in terms of helping elevate just the SCALEUP program, right? Not to mention probably the 10 or 20 other activities and programs that you all are doing, but there's no way that I could have done as much as has been done in the last year by myself, or even with our team of researchers that we have. So we're very thankful to you all. And part of that support is not just with short-term activities. What we're working on is developing a long-term relationship with businesses throughout the state, a network of businesses that we're able to work with for research purposes. But rather than just taking from these businesses, we're also trying to give back to them as well, right? It's a two-way street for these long-term relationships to be fostered. So developing this network of small businesses across the state, right? Sounds phenomenal. That's great. That's wonderful. But how do you do it? Then we struggled with that for a while. And so we had the idea of recognizing businesses for what they had been through. There's a focus on resilience here. And just about all small business owners have had a struggle or two. Not to mention the pandemic, natural disasters, other public health emergencies. So we developed the GRIT Awards. And GRIT stands for Great Resilience in Texas. Open nominations to all small businesses from across the state. Some were self-nominated. Some were community member nominated. We received nearly 100 nominees. Many have joined this research network. And in fact, we have getting ahead of myself here, we have a showcase. So we're at the later stages of the program now. And we've selected winners. In fact, we have 3. Jessica, help me out here. The name of the top 30.
Excellence and resilience, just overall excellence and resilience, and then 4 that we recognize for specific aspects of resilience. So adaptability, collaboration, preparedness, and dependability.
Excellent. Is that right on? So we have those 3 winners, and then the other 4 with a showcase that will be on Tuesday, April the 25th at 3 p.m. And for your convenience, you can register.
It's gonna be a great show.
We also have
Right here.
cards on the table.
Yeah, some cards on the table. This link will take you directly to the registration site. And 1 hour online via Zoom. The winners, you may ask, well, what do they get? What's in it for them? A few things. One is a beautiful trophy, a nice award that they can display, along with a certificate. And we thought quite a bit about what they, what does the business owner actually want, right? What's going to mean It's not going to be a check for $100 or what. But the publicity is helpful. Free advertising is beneficial. And so that's exactly what they're receiving. In fact, thank you again, Melinda. We were able to send the professional production crew to each site, to the site of each business across the state, and make some great videos that we then give to the businesses. Now, of course, we get to compile all that, right? And that's part of the showcase and whatnot. But it allows them to have, a 30-second snippet, 1-minute snippet that they can use for social media, for the websites, etc. And they look really good, by the way. The company out of Waco did an excellent job with those videos. Here's a few pictures. Here are a few pictures from the video, one's from the video, a few from the video shoot. This was at Texas Tito's in New Brunswick, one of our winners, not the Tito's you might be thinking of, by the way. Right through, you selected Texas Tito's, no, not that Tito's. They package different types of pickles, right, individually wrapped, some
They're HEB, but they're an HEBs, for the checkout.
and some great flavors. And so I was able to visit with them and actually give them the award, and they have a great facility. Jessica, surprise, here's a picture from the interviews that they did with some of us about the Grimm Awards and whatnot. Again, turned out to be a great video and great opportunity. And a few weeks ago, I visited another business and was pleasantly surprised to see that they had the award displayed right up front by their cash register. Still call them cash registers?
Yeah.
Checkout counter at the salon. So there it is right there. So we're talking about, the overall theme of today's conversation is related to community network building through research. So for me, I see that as then research is affecting, right, is influencing, enhancing community network building. But also by building that community network, that's coming back to enhance your research. So this is certainly an ongoing relationship here, a feedback loop, if you will. Through the process of working with SCALEUP and THRC and the team here, we've developed quite a few partnerships, not just with TSLAC and TMOC, other departments on campus. For example, the Department of World Languages and Literatures has been very helpful with conducting translations. We've translated the full website, the full SCALEUP website, in English and Spanish, and we have also translated interviews and transcripts and those types of things. Here are a few of the other sponsors. Melinda, I put this quote up here because you say this quite a bit, that a rising tide lifts all boats. And I'll say, it's not just something that Melinda says. Many of you know her very well. She lives this and makes it happen. First part of the presentation, she did not say, I'm doing this for my research, right? It is what can the university do to help enhance everyone's research? How can we help not just McCoy or engineering? Let's create multidisciplinary relationships so everyone's vote can arise. And I tell you this often, but I genuinely appreciate and respect that. The selflessness and the foresight that you have for what that has the potential to bring to the university.
Thank you, but it's not selfless at all. It's the fact that all of us are busy. None of us can do everything. We need to work together. And things are just so much better and so much more interesting when we do. And the biggest pushback we get is from internal, oh, is this mine or yours? And how does this count? And all of these things that stand in our way have limited our university potential for our research mission. And I'm not buying into that anymore. So it's not selfless. I love it. And
Is there an amen from somewhere?
there, I mean, my opinion, but yeah.
So through this process of working with SCALEUP and whatnot, we shared our connections, but we've also benefited from that, right? We've been able to create new connections by sharing those. We shared our research ideas, and they've helped expand our research ideas. We've recognized businesses, and then they come back to help us by joining the research network. And we created the Grid Awards. And it comes back to help us as a university to become known potentially as a hub for small businesses and minority-owned business. So I want to end with a thank you again to THRC, Melinda, the full team. It's a pleasure working with y'all, and it's always great to work with folks who are doing great things. So I'm also interested in hearing from you all. This is a conversation. So we can ask any type of question, but related to today's topic, in terms of networks and relationship building, are there things that you all are doing to reach out into the community and build networks, create new relationships, etc.? Yeah.
Hi, my name is Rebecca Davio. I am the director of the Institute for Government Innovation. It's a little on-campus consultancy associated with the geography department. And we are working with Texas Search and Rescue. It's a nonprofit association, and we are working with them to, we've been working on a couple of projects for Texas Mutual Insurance. And we have developed the Texas Small Business Disaster Resiliency portal. And the synergies on that are like, it can hardly sit here.
Yeah.
And it's like, oh my gosh.
And this isn't a joke, right? It's serious.
This is no, I'm like, thank you, God. This is, it's like, this is, oh my gosh, amazing. Because the opportunities, Texas Small Business Disaster Resiliency Portal.
And see, I talked to Rebecca a lot of times because I know her center does really great work and trying to think about the connections. I did not know this, but this is why I feel like this kind of event and this kind of meeting that I'm here is worth every minute you put into it, because this is going to be good for them and good for all of us, probably, in terms of, whatever potential can come from it. It doesn't happen on Zoom, and it doesn't happen, nobody sticks a sandwich to the keyhole of your office, and says, hey, I want to give you some money and work with you. It doesn't work that way. So I'm so glad you came. Thank you. And that's perfect.
Yes, we're working now on, from the SCALEUP side, on developing a hub of resources. But we need to certainly talk, because we've also talked about the resilience aspect of that. Perfect. All right, we can up that.
I can't up that.
Oh, come on.
I have a couple of thoughts and comments. I've known Melinda for quite a while now. I'm part of the Translational Health Research Center. I'm chair of the Clinical Life Science Program at the College of Health Professionals, Rodney. First of all, just in what you're doing and building those networks, I'm curious, you mentioned the group out of Waco that helped you. And I'm sure maybe you thought of this, but have you thought about working with our research, video, and production crews to kind of come in with you to offer student intern opportunities? And that's going to kind of bend towards my world. So now this is more about healthcare. The single biggest national crisis we're facing in healthcare in the country right now, beyond the pandemic, it's an effect of the pandemic, but it's been here for a long time, is clinical placements for our students to gain experience. And I'm just kind of wondering, this is a huge issue. It limits the enrollment of our programs. It limits the workforce. It leads to burnout. It leads to early retirement. I mean, it just goes on and on and on and on. Everything that's wrong with healthcare. And so I'm wondering how this might work. You're working with businesses. And I'm wondering if there's an opportunity to work with healthcare systems that would be a two-way opportunity to build that type of relationship. So I'm just kind of thinking about that out loud because it's a huge issue that we're having a hard time solving with our traditional fault patterns. So it's almost unsolvable because the workforce shortage is so bad that you can't get people to take students. And so it's just an ongoing feeding frenzy, if you will. So I'm
Do
just.
you have an estimate or rough estimate what percentage of students in this program or these programs are not able to?
Well, I'll just give you my direct experience. So in medical laboratory science, which I'm chair, and around the state, we typically can only accept 20 to 30 students per year. It's a selective process, but that's not the limiting process. It's not the GPAs or the credibility of our applicants. It's that we can't place them, and they have to be in places to graduate to get that experiential learning. And so I can get 40 or 50 applications a year, but I can only take 20. I'm turning away 30 potential bobcats. And this is just me. This is nursing is crazy. Other programs are crazy. And I don't want to dominate the conversation, but it's a problem that I'm sharing with you and with Melinda. She's kind of heard me talk about this before, but I'm just looking at your model and wondering if there's a way that might be something to visit about later. And we can do this later, but
I would say yes. But for us, our projects are faculty driven. We don't, well, COPEWELL, I will fully admit, because it was the very first one we had to get something happening. I kind of pursued that, but really our projects are things that our faculty members bring to us. And then we try to blow it up and do things with it. But I don't want to, faculty like to have, academic freedom, and I support that. So if there were a faculty member, I would love to work on this issue. In fact, we've already laid groundwork on this issue for 2 projects next year that are sort of coming together, but it's a crapshoot, honestly. If we can find faculty members that will have time for a buyout to do a project, to work on something with us that they want to do, all those things have to line up before we can pursue a topic. So it's not like we drive the train, but that's right in line with what we would love to do.
Amy?
So, I am on the board of the Texas Association of Charitable Clinics, working with the National Association of Rehabilitation. The president is here because broad, they need people to come. I don't even know if there's such a thing as having a clinical internship or externship, the career charitable clinics, but they need everything, all hands on deck. It's a fire. You think that the healthcare system is bad in the United States? Well, think about that healthcare system for the uninsured or the underinsured. They go to the street clinics, they are scrambling for any form of help. Most of it is in the form of low paid or honorarium paid MDs, no paid volunteer MDs. If there was such a process that we could create as a state to enable these sort of internships and whatnot at a free internal clinic, there's power there. The second is you know, I had to meet the executive director of and I think that they also serve in margins where rural hospitals and systems are being defunded by Medicare and Medicaid right now. There's a whole system in fact where they have to re-up the Medicaid now. So even systems that are these sort of, you have these rural systems that will take Medicaid, even those clinics, if Texas doesn't get right, are about to close. It's going to be an inundation of pre-terminal clinic patients or floods of emergency room patients that then we pay for in insurance. So in my mind, they too are in these very margins in these rural areas, in these underserved areas. There might be worth sort of bringing them into COPEWELL and bringing them into the office. The third thing is all of these are not-for-profits. They're folks who have the kindness of their heart, want to do something, just want to help their community. They know nothing about business. They are entrepreneurs. These clinics are either owned by the MDs or PhDs and they need help. They need time, they need help. Sort of having a sustainable business model for a nonprofit that with a sorting in the margin. So in my mind, can y'all just please be thinking about pre-surgical clinics as you're doing all these wonderful things with places that have funding like Johns Hopkins and other places. Just please keep in mind the least of these. That's all I have to say.
Great point about particularly adapting some of these insights or even some basic business practice.
Or even they invited them to grid. Think they were gritty? When they were fighting the pandemic and the margins?
Absolutely.
They were.
I do some work in the entrepreneurial mindset. And the university is working now on approving a university-wide minor in innovation and entrepreneurship, not just for business students, but with the argument that any student who is able to think more entrepreneurial, and by that, it doesn't mean starting a business, but it means having a cognitive perspective that allows an individual to see opportunities where others don't see them. And not just recognize, but then act on those opportunities in contexts that are changing for the purpose of creating some value.
And I will say that they are trying to develop toolkits to help folks who are trying to do these startups. Essentially, like when you see a need in your community and you're trying to commandeer folks who will work for practically nothing or free to provide health services in the community. Sometimes, you know, they don't know how to do it. They don't care. They're just doing it out of the kindness of ours. They don't know the sort of logistics of a startup, and they're not thinking how to use our tools at disposal to our fees. And even that, something like having with them provide the library some form of grid or scale up toolkits or resources. And I'm willing to do whatever I feel hard for this to work. So I'm willing to help with finding grants for y'all. I'm assembling apply for PI if I can do it myself. I'm filling the gaps, however necessary.
Jessica, we can probably at minimum extend some invitations
For sure.
to
Yeah.
Amy, did you capture the QR code?
I did.
I'm just kidding. Yes, of course. Actually, speaking of QR codes, here they are again on the right. One of the metrics we have for SCALEUP is the number of individuals per year that we sign up on the website to receive updates on research, on tools, etc. So if you are able and willing to sign up, please point your phones at the QR code on the right. Other thoughts, insights, takeaways? Ready? Not to put you on the spot. Anything?
Yes, startup companies, spin out companies, access to technologies. Maybe I'm confident they can sign up.
Are we talking about at Star Park or other?
There are startup companies started with ideas.
Okay, okay,
You know,
okay. That's a great idea. In fact, Jessica and I had talked, invitations either have been sent to those at Star Park.
Next week.
But it will be sent.
Yeah, we're
To
gonna.
those at Star Park.
Because we actually at the Health Scholar Showcase had some good, at least one good, great conversation with a person who is one of the incubator businesses, Pastor. And so, yeah, we want to extend invites all of them to come to the showcase. But the showcase is about celebrating these winners, but it's also about launching this idea of like, this is this network, these are your people. We want to build this conversation and keep it going. So anyone who wants to come, join, please do. To learn and share.
Yeah, and so I want to thank Josh. This project has been so exciting, and it's leading to more and more business research and sharing entrepreneurial practices. And it was a little bit of a step out for me, and I justified it. I said, well, this is great resilience in Texas businesses. But it was during the pandemic, so that was held. So I was like, okay, I can wrap my head around it. But I see more and more that, you know, any kind of resilience rests on the assumption that we have our health. And if we don't have health of individuals and communities, it makes it very challenging to not only, you know, be prepared for, but just to, you know, a sustained effort during something like a pandemic or a tornado or a flood. We've seen how whole communities just disappear. You know, we see how people migrate. We see all these things that happen when adversity occurs without resilience. And so I see these as being very linked now. I wanted to just mention really quickly, because I'm, you know, promoter, in addition to the business network that will be ongoing related to this, where we will have a convening online on a very regular basis of small businesses in Texas throughout next year. We have a similar network for firefighters that came out of one of our projects, and a similar network for librarians, and to connect them together. So, you know, the more you do these kind of things, just the most unexpected things happen. I ended up on a federal task force that's looking at, it's a federal agency that's over all libraries and museums. And there's the assistant secretary of fill in the blank for DHHS, Homeland Security, just fill, and then, you know, hi, Melinda Villagran. So they're like home literacy, digital literacy, financial literacy, and they're looking at how we can use exhibits to help people understand resilience in museums and in libraries and bring resources together. This business network and this set of resources for businesses will be able to be shared across Texas libraries because of this. And you know, it elevates everything you do when you just think about what's possible instead of, you know, I gotta write this article and submit it to this journal so I can put it on my annual review. I just didn't find a lot of joy sometimes in that process. I found it, you know, I love what I did, but I didn't love that process because it didn't just fulfill me in the way that it does when I see how research can be impactful. So we've built a network of resilience university research centers, so we can connect the people doing resilience research, firefighters, librarians, and businesses. But I would love to have something more sustained with healthcare organizations. We do have one project that has a person that's interested in that. It's the research director for Christus. And so we're kind of exploring that, but if there are other ways to do that, I would love it. And I would invite Amy to invite her people from the free and charitable clinics to join the business at work, to learn about how, you know, how to do the business of healthcare in ways that maybe that are possible, right?
Absolutely.
So, I mean, there's a lot of ways for you to connect with each other on our campus. And there's a lot of ways for you to find resources if you have a project, if you want to extend what you do. We're also doing a project I'm so excited about, which is about health news and about data visualization and helping people understand health issues. And so working on a journalism network that will extend across the state to share stories about our research and about the topics that we study and the health issues that we help to try to solve. Because again, getting it to the people that actually need it can be an implementation kind of thing, but it can also be news. And so I'm very fortunate to have Jeff Fox and Terry and Daniel Carter from SJMC that are working on that project and ramping it up. So we're just trying to think of all the ways that we can help build community research networks and partnerships that will support Texas State faculty research and grants. That's our goal. And so anything that you bring to us, we welcome, and we will also try to help you. And the very last thing, and I know that you mean this too, because we are both fortunate that we have THRC team. I want to like say that loud. Hello, THRC team is amazing. Everybody, and Catherine, marketing communication, Abby, assistant director of health scholar showcase, director of Learn. Shelby, research coordinator extraordinaire, works on a lot of projects with Jessica and others. Emily, Abby 3 makes everything run for us, on a daily basis. Jessica Snyder, director of our faculty fellows program. Shadi is our GIS specialist, so we can look at place-based research because we're interested in the health issues, the economic issues that happen, but we have to understand them where they happen too, given the way that we do what we do. So having Shadi has been amazing, and she's also working on research projects with our Texas State faculty. And Marsh Birdie is director of community partnerships to help us maintain and establish these relationships and feed them and foster them in ways that are mutually beneficial so that we can continue with all of these different organizations. And who knows that? Okay, anyway. Thank you so much for coming. I appreciate it.